Sent her next door to a radiology clinic for an x-ray. That was all they did. A slow day for Lizzie, but it turns out a profitable day for Bicentennial. They diagnosed Lizzie as having phlebitis.
Right. That's impossible.
What do you mean it's impossible?
It's impossible to diagnose her with phlebitis with the physical exam that they did.
You can't tell phlebitis by leaning over a desk and touching two knees?
No, you can't. Not at all.
So what is this, just a bogus diagnosis to justify some tests?
Yes, it was a bogus diagnosis.
It's going to be a long wait.
Even though Lizzie was only given x-rays, Medicare was billed for a battery of procedures. Doppler tests, artery scans, lower extremity scans, over $800 in tests that were never performed. We only spent a few weeks going to clinics, but we found that once you're in the loop, you can go as often as you like. Just ask Tommy Miller.
I figure it's easy money. Half a day's work.
Miller spent a year and a half going to clinics around Miami and getting paid for it. No bones about it. You were a professional patient.
Yeah, you can say that. Yeah, making that money, you know.
At the height of his career as a professional patient, he was going to clinics several times a week. When we got Miller's records from Medicare, we found bills for over $64,000 from more than 40 different clinics and labs. Many of them, he says, he never even visited. As for the tens of thousands of dollars in tests he actually did have, did they ever send you the results of the tests?
Never did. Never did.
Do you think that these clinics and these doctors were interested in taking care of you?
No, I don't think so.
What do you think they were interested in?
In making money, just like I was. That's all.
There are more than 1,000 clinics in the Miami area, and state officials estimate that as many as 300 are ripping off Medicare. So far, the clinics Lizzie visited have billed Medicare more than $15,000, all operating in the open with no apparent fear of getting caught.
As soon as we figure out what they're doing, they switch schemes, and they are becoming more and more sophisticated, and we are still running behind, trying to catch up with them.
But, as you'll see, someone did catch up with them. Us.
When we return in a moment, Chief Correspondent Chris Wallace confronts the doctor.
Not even provided. Now watch what happens when Chief Correspondent Chris Wallace confronts the clinic operators.
As we investigated crooked clinics in Miami, one thing that surprised us was that they operated so openly. It turns out to start billing Medicare, you don't need a license. You don't even need to prove that you have any medical equipment in your clinic.
The bottom line is that you can go into business and there's almost no oversight, there's no inspection whatsoever.
And once you're in business, if you want to defraud Medicare, odds are you won't get caught. Weir Jensen, a medical billing consultant, looked at Lizzie's claims from our clinics. If you're a clerk sitting in some office seeing these bills come over the computer, what would you do?
I would pay them.
Because?
Because the diagnosis fit the procedure.
You make it sound like a game. As long as I give you a diagnosis, I can bill anything I want.
Unfortunately, that's correct.
In fact, the clinic's claims for Lizzie were never paid because we told the Healthcare Financing Administration, or HCFA, which oversees Medicare, about our investigation. Afterwards, HCFA Administrator Bruce Vladeck said his fraud detection system would have caught more than half the claims anyway. He wouldn't say how. But Vladeck acknowledged the government hasn't been able to stop the spread of these crooked clinics. Are you surprised that we were able, in a matter of several weeks, to find 7 clinics?
No, I think you guys are very good.
Well, is it that we're so good, or is it that you've got a real problem in South Florida?
Obviously, we have, in a number of areas of healthcare fraud, a particular problem in South Florida.
After looking over all the bills sent to Medicare, thousands of dollars for tests that were either unneeded or never done, we're now going to send Lizzie Green back into the clinics. But this time, we're going with her. Our first stop, Miramar Medical Center. That was the place that billed $1,400 for a series of tests Lizzie didn't need, including tests for allergies and syphilis. We wanted to talk with Dr. Lopez, who examined Lizzie. We found her outside the clinic. She invited us in, but some of the other workers there didn't seem so glad to see us. You were the only one who saw Lizzie. Are you a doctor?
No, I work at the quality assurance.
It turned out Lopez is not a licensed doctor in Florida, but a quality assurance staffer, involved in administrative work with no authority to treat patients. You were introduced to us as Dr. Lopez.
Okay. Me llaman aquí doctora.
They call me Dr. Lopez here because I'm a doctor in another country.
She told us she's a doctor in the Dominican Republic, and that all she did with Lizzie was write down her symptoms. So who made the decision to give her all of those expensive tests? Dr. Castillo. She's talking about Jesus Castillo, the owner of the clinic. After waiting more than an hour for the doctor, we decided to pay a house call. Dr. Castillo, Chris Wallace from ABC News. How are you? We asked about all those tests they gave Lizzie. Castillo said he would have to look at her file. Well, I want to know something. Do you pay patients to come to your clinic?
No, I'm sorry, I'm not.
Because this woman was paid $100 to visit your clinic and to take these tests. She was paid by Evelyn, who comes to your clinic often, a driver.
I don't know who's Evelyn, right?
Well, the people at your office know Evelyn.
I don't know, sir.
We wanted to ask Castillo more questions. He said, talk to his lawyer. A lot of doctors didn't want to talk with us, such as Jaime Verhel from the Technocure Clinic. That's the visit where Medicare was billed almost $4,000 for tests Lizzie didn't need. She said the only problem she had was that she had knee pain. When we found him outside another clinic, the first thing Verhel did was hand us a business card for his lawyer. Could you explain to me why you charged $4,000 when all she had was knee pain? Do you have a reason for that, Dr. Verhel? Doctor? Can we come in?
No, you may not.
Why not?
Why not?
It turns out Verhel is a busy man. According to Medicare records, since 1985, he's been a doctor at 28 different clinics in South Florida. As for the Technocure Clinic, where he saw Lizzie, that location is shut down. We were surprised that such a busy and apparently profitable operation would close. But Prosecutor Demergent says many clinics do this.
By the time Medicare has recognized that there's a problem, the company has vanished off the face of the earth. And then they're simply reborn at a different post office box as a different provider.
Then there was Northwest Medical, a clinic that billed Medicare for follow-up visits that Lizzie never made. They had also closed. So we tracked down the doctor who saw Lizzie, Jose Valiente. Dr. Valiente? Yes. Chris Wallace from ABC News. How are you, sir? We wanted to talk to you. Are you involved with the Northwest Medical Clinic? The reason I ask is because why is your name on these bills? This is Jose Valiente. That is you? If we seemed a bit confused, it's because the Jose Valiente we were talking with was not the same Jose Valiente who examined Lizzie. And there's only one doctor with that name licensed in Florida. This Dr. Valiente said he used to work at Northwest, and it was his billing number that appeared on the claim sent to Medicare. So who was the man who saw Lizzie? We showed him our hidden camera tape.
I don't know these men. What is his name?
I don't. He said he was you.
Well, it's so obvious that he's not me.
And he ordered these tests, and he put his name down.
Well, that's forgery, my friend.
In other words, a man impersonating Dr. Valiente not only saw Lizzie, but used his name to bill Medicare for $545 worth of bogus tests. But one clinic was still in business, Bicentennial Medical Center. Outside, we saw Lizzie's doctor. We sent Lizzie in to see you. He invited us in, but said we had to speak with the clinic owner, Milton Gari. We told him about Lizzie's visit there, that Medicare had been billed $800 for tests that were never done.
I'm sure that if we billed for the test, they had it done.
Why are you sure of that?
Sir, we never bill for anything that we don't do.
You don't run up bills for Medicare?
No, sir.
You don't bill Medicare for procedures you don't do?
Never I have done that.
And what about the driver, Velma, who took Lizzie to Bicentennial and seemed to be working with the clinic? What if I were to tell you that the driver who brought Lizzie here paid her $50?
That's a lie.
That's a lie?
Yes, sir.
What if I told you we have it on videotape?
Show it to me then.
We showed Gari what happened during our visit. Velma brought Lizzie to the clinic and picked her up. And guess who was there to greet the driver? You know this woman, yes?
Yes.
And you call her in to talk to her. And then I want to show you, there you are.
Come on in, Mr. Goldman. Wow, you're looking very sharp today. Are you going out tonight or something?
And then Velma takes Lizzie. And if you look carefully, you will see Velma reach back and give her $50 in cash. Why is Velma paying Lizzie to come to your clinic?
Sir, at this time, I'm not going to talk to you anymore.
But you told me this never happens.
I can assure you that never happened.
What we just saw on our eyes never happened?